Mastered lithium across 10 episodes, but now it's crunch time. Let's pull it all together in one final high yield fact. In the next 10 minutes, you have everything you need to crush any lithium question. Let's look at mechanism and indicators. Quick review. Lithium is a mood stabilizer. It is the gold standard for bipolar mania and maintenance. It reduces suicide risk. Exams like to ask you this question. So you want to always think lithium equals mood thermostat, mood stabilizer, and it's also a shield for suicide. Let's explore pharmacokinetics. It is absorbed in the GI tract. It's not protein bound and it is not metabolized. Lithium is 100% renally excreted. Lithium follows sodium. Half-life, 24 hours longer in elderly and individuals with renal impairments. For your exam, anything that changes sodium or the kidneys will change lithium. You must know is the therapeutic range and its monitoring. For maintenance, we want to have lithium level between 0.6 and 1.2 milliequivalent. Toxicity will be greater than 1.5. In severe cases, it will be greater than 2.0 to 2.5. You want to check lithium 5 to 7 days after start or after you do a dose change, and always 12 hours post-dose. We want to check baseline BUN and creatinine levels, TSH, electrolytes, CBC, do a pregnancy test, and ECG, especially when individuals are older than 40 years old or individuals who have a cardiac history. You always want to do ECG. So before lithium labs, during lithium, pretty much you do labs throughout the course of lithium therapy. Let's look at side effects. A common side effect will be GI upset, fine tremor, weight gain, and polyuria. In long-term cases, we might begin to see hypothyroidism, some nephrogenic issues, renal impairment, but serious side effects are associated with arrhythmias, hyperparathyroidism, irreversible chronic kidney disease. For example, fine tremors would equal side effects, while coarse tremors are toxicity. Look at toxicity progression. Early, we talked about GI upset, nausea, and fine tremor. But when it's moderate, you begin to see symptoms of coarse tremors, confusion, slurred speech, and ataxia. Severe toxicity, seizures, coma, and even toxicity triggers are going to include dehydration, hyponatremia, potassium shift, drug interactions, renal impairment. Remember that. Drug interactions, remember the toxic trio. NSAIDs, it reduces renal blood flow and increases lithium levels. Thiazides increases sodium loss, and then lithium is reabsorbed. ACE inhibitors / ARBs reduce GFR, thereby increasing lithium levels. New medication plus lithium, you always want to remember, check for interactions. Special populations. Pregnancy, there's a risk for Epstein's anomaly, especially in that first trimester. Avoid lithium in breastfeeding. For the elderly, you want to lower doses, check labs more frequently, and they do have higher sensitivity issues. Adolescents will want to pay attention to dehydration risk, especially during sports and illness. Monitoring, you want to always remember, for an instance, a 32-year-old just started lithium. When do you check the first level? You always want to check 5 to 7 days after starting that lithium dose, because remember that steady state is reached in 5 half-lives. You also want to determine, is this a side effect or is it toxicity? For instance, a 28-year-old has hand tremors. Lithium level is 0.9. Your answer will be side effect. Fine tremors is benign, but always remember that coarse tremor equals toxicity. Case might sound like a 55-year-old on lithium starts ibuprofen. A week later, she experiences confusion, diarrhea, and lithium level of 2.1. Your answer is going to include NSAID interaction, which of course will lead to toxicity. Pregnancy scenario, let's look at a 25-year-old in her first trimester, continues lithium. Your answer will be due to Epstein's anomaly risk. Your safer option would be to switch that individual to lamotrigine. Let's look at the older population. A 70-year-old on lithium develops confusion, gait instability, and lithium level is 1.0, which is normal. So what would be your answer to a question like that? Toxicity from age-related renal decline, even at normal level. That's the kind of answer you want to be looking out for. do we manage toxicity? A 40-year-old with coarse tremors, diarrhea, confusion, and lithium level is 2.4. The best course of action will be to stop lithium, hydrate that patient, and admit. If severe, dialysis may be required. Your answer at this point is not just to reduce the dose. Wrap up lithium in one line. Labs, levels, lifestyle. Labs equal to baseline and ongoing. Okay. Levels, it has a narrow therapeutic window. Lifestyle, hydration, salt consistency, no NSAIDs. If you lock that in, you'll pass every lithium question and keep your patients safe. Congratulations, you've completed the Lithium Masterclass. Share this series with classmates and revisit this recap before exam day. You will be ready. Don't forget to subscribe.